Good afternoon. Can I start?
Yeah, sure.
Thank you. Good afternoon. I'll be speaking on post-COVID surge in cataract volumes, a big surprise. The government of India declared a nationwide lockdown on 23rd March 2020 because of coronavirus, and the entire health fraternity came to a standstill. All non-essential elective surgeries were postponed, and in ophthalmology, cataract surgeries constitute the major chunk. We all know delaying cataract surgery decreases the quality of life and increases the risk of accidents. So, the aim of this study was to observe the impact of pandemic on cataract surgical volume in post-lockdown period and to observe the change in morphology of cataract, if any, at presentation in the post-lockdown period. So this was a retrospective study divided into two groups. One, Group A, pre-lockdown, before the lockdown was announced, and Group B, post-lockdown, between 1st August 2020 to 21st March 2021, when the relaxations were announced before the second wave. And we tried to match the figures of months and dates with the pre-lockdown period so that we can get a comparable data of patient month-wise. And all the patients underwent manual SICS, and the guidelines given by AIOS were followed, and routine PCR, RT-PCR test was done for all patients. So as expected, the average daily OPD attendance decreased from 146 to 111 per day. But interestingly, this decrease was more in females than males, and this was statistically significant. The number of mature and hypermature cataract increased from 18.7% to 24%, and the number of lens-induced glaucoma also increased, and this was statistically significant. The number of cataract surgeries done per month increased from 88 to 121, and this was also statistically significant. The number of patients undergoing other eye cataract surgery also increased from 78 to 186, and this was also statistically significant. So there are some studies. Kosar et al. Reported that the female patients decreased, and we also found a similar result. The overall OPD attendance decreased, but the number of females decreased more than the males, and this difference was statistically significant. And in a study by LVPI Hyderabad, the proportion of mature brown black cataract lens-induced glaucoma increased from 15% to 43%. Another study by Maulana Azad Medical College, New Delhi, also reported that there was a spike in surgeries for mature cataract, 57%. So these also results match with our studies. Prior to the pandemic, the number of cataract surgeries was higher as reported by PGI Chandigarh, and it decreased later on. This does not match with our study, because in our study the numbers increased in the post-lockdown period. So the take-home message is that because of the pandemic, there was a huge cataract backlog created, and this backlog needs to be addressed actively. So one of the options is immediate sequential bilateral cataract surgery, but this is not so popular. So what we can do is we can decrease the time gap between two surgeries to a minimum with which the patient is comfortable. And we can take the help of eye camps and teleophthalmology services to detect eyes with advanced cataract so that they get priority in surgery. These are my references. Thank you, Aquine. Happy New Year to all for giving me